So this is my Ready Medical product. Today I'm going to be using the anti-aging hyaluronic acid with growth factors. There's 8 different growth factors in this, and it's a great PRP alternative because number one, it's always ready to be used. It's sterile, and more importantly, the growth factors in this is 100% biocompatible with the growth factors we naturally produce, and therefore is great anti-aging solution. Sometimes our clients are older and so they just don't produce the amount of growth factors, or on their medication, or they can be compromised in other ways. So this is a great alternative to that. So I am going to just blend the product back and forth 3 times. 1, 2, 3. And I really don't want to overblend this because the nature of hyaluronic acid, it expands, right? 1,000 times its weight in water, and it retains that. So if you over mix it, it becomes very jelly-like, and which I don't necessarily want to do. So I'm going to take this apart. I have all my product in here, and I'm going to find my little applicator that it comes with, and I'm going to apply this on the tissue. And again, this is sterile, so it's absolutely perfect to apply with any microneedling treatment or radiofrequency microneedling treatment, or any place where you need a germ-free product. So I'm just applying this evenly over the tissue, and she's going to feel relief from the heat almost immediately. Right now she feels like she has a little bit of a sunburn. And again, it's important to have that sonicated hyaluronic acid so it can absorb at different layers of the tissue. A lot of times our hyaluronic acids are just coming in a powder form, and as soon as you mix it into product, it becomes a higher molecular weight, which really doesn't absorb. It creates more of a barrier, which still has its benefits on the top of the skin, but it doesn't absorb into the tissue the same way as a low molecular weight structure would. And again, it's something that has to be done after it's mixed, because any kind of low molecular weight product that is just mixed up, it just gets engorged with liquid, and it becomes a huge molecule size, just the nature of the beast when dealing with hyaluronic acid. So I'm just going to apply that, and it's going to be very soothing on her skin, and that is going to do a couple of things. It's going to really reduce her downtime. Her skin is going to feel comfortable almost immediately. Plus the growth factors, which include TGFB3, which creates collagen type 1, VEGF, which creates new vascular pathways in the skin. It's great for anybody that's aged, because a lot of times their vascular network in the tissue has been compromised, so this is really going to give that a boost. And all the other different growth factors, copper tripeptide, which is going to help with collagen synthesis and everything else. So it is going to be a beautiful, beautiful result on her skin, plus an amazing aftercare component. We are going to be going through another video on this later, so with all the other treatments as well, so you'll get a little bit more information then. But beautiful, beautiful aftercare. Now I'm going to apply a derma roller mask. I'm just going to hit this a little bit, and this mask is a great rapid recovery mask. We'd use it after all of our regular microneedling, but I like to use it after our radiofrequency needling as well. And it's a silk-based mask. I just like to sort of hold my fingers and let a lot of the excessive liquid be at the base, and I'm going to show you how to send that home for home care actually. And I unravel this mask like this, and the blue portion, normally it's discarded because it's sort of the rough portion that holds that just protects the silk mask. I'm going to apply that underneath her jawline just to give her a little bit of a reprieve. And again, there's matrixyl, vitamin E, and hyaluron in that particular mask. And I'm going to set this on her skin. It's going to help her skin recover just wonderfully. And it's going to include that Ready Medical product on her skin. And the results are going to be lovely. And most of the redness is going to be subsided even before she leaves. So I'm just going to apply this like a second skin. And she's going to say, because it's going to feel so much better right away. And her skin is going to be super hydrated and plump. after this treatment, because all of those little channels that we created with the RF needling is going to be absorbing all of this beautiful hyaluron and matrixyl and growth factors, and it's going to help expedite healing, and she's going to have just a wonderful, wonderful result. I'm just going to show you a little trick I like to do. After any kind of microneedling, they of course need aftercare, and one of the most important aftercares would be hyaluronic acid. A lot of times if you're using something, I would not put a sunscreen on immediately after this, because sunscreen has a lot of chemical components to it that if it gets super absorbed into the skin, it could cause a histamine response, etc. So what I like to do is, remember I was saying how we have so much hyaluronic acid and matrixyl in these envelopes. I like to just use my syringe, because it has a cap that I got with Ready Medical, and I just do, and this is going to be great for them on their way home. Again, you're not letting anything waste, because this is a really beautiful serum. And so I just created a whole syringe of hyaluronic acid for her to use on the way home, because a lot of times just to bring some hydration and relief to her skin that's going to be warm. So here I just made a nice hyaluron treat for her for the immediate use once she gets home. A lot of times we sell the extra derma roller masks for aftercare as well. And here she has almost 2 syringes of hyaluronic acid that she can use immediately. So now I have 2 full syringes of hyaluronic acid with matrixyl, and they can also buy some extra derma roller masks for recovery for the first 48 hours, and then they can go on to their regular home care. They can resume their sunscreen. It's basically sun avoidance for the first 24 to 48 hours, and then they can resume their sunscreen shortly after. Of course, always use fresh new product after any time your skin's been compromised like this, because you don't want anything that has high bacterial load in it. If it's been sitting around in their cupboard too long, they should not be putting that on their face after these types of treatments. So if you have any questions, just feel free to inbox me. I'd be happy to answer them, and talk to you soon.